everybody, my name is Felicity Rose and I'm a professor in biomaterials and tissue engineering within the School of Pharmacy here at Nottingham. I teach first and second year students on the pharmacy and pharmaceutical sciences courses about bacteria and how we can treat infections, in particular using antibiotics and how they work. And that's what I'm going to talk to you a little bit about today. So bacterial infections and antimicrobial resistance to antibiotics is a major healthcare challenge and it affects everybody. So today what I'm going to talk about is about bacteria, how they cause infection and the different ways in which we can prevent and treat infection once they arise. So what are bacteria and how do they cause infection? Bacteria are microorganisms. They are known as prokaryotes, which means that they don't contain a nucleus. Bacteria can be found everywhere. They can be found in soil, water, plants, and also in and on our bodies. In fact, about 1.5 kilograms of our body weight is just due to the bacteria alone. We can find bacteria in our gut, on our skin, and up our nose. And they're really important to us. We live in a symbiotic relationship with them. They help us break down our food and produce nutrients that we can use for our daily needs. However, some bacteria can make us feel ill, and these bacteria are known as pathogens. So they can cause infection and cause disease. So how does an infection arise in the body? Well, first of all, we are exposed to these bacteria that cause infection called pathogens, and that might be through touching something where the bacteria is present, or maybe eating food that's gone off. And so they will stick to our skin or to our mucous membranes, so the lining of our mouth or our nose or in our stomach, and that lining is called the epithelium. And once they've stuck to the epithelium, they can then invade into the body. Once they're in the body, they can increase in number and grow, and they can produce chemicals called virulence factors. And it's these chemicals that help them grow in our bodies and cause infection. Those chemicals can make us ill, and indeed our own immune response to that infection can also make us feel quite ill as well. So the bacteria can either stay at that site where they first entered the body, or they can move around and they can go to a different site, or they can get into the blood and move inside our bodies that way. But wherever they colonize and grow, they will cause tissue damage, and that will cause disease. So we can use antimicrobials to prevent and treat infection. There are many different types of antimicrobials. There are some that we can use on surfaces on our skin, so like creams and ointments, and we might use these after a cut or graze to prevent bacteria from getting inside the body. We can use them as preservatives in foods or medicines to prevent bacteria growing. And we're perhaps all familiar now with the use of hand sanitizers, so alcohol gels that we can use on the skin or on the surfaces to remove bacteria. And if we have an infection in our body, then we can use antibiotics. And I'm sure we've all taken antibiotics at one point in our lives. So antibiotics are chemicals that actually bacteria secrete themselves, and they do that because they have to live in a competitive environment. So they have to fight off other bacteria so that they have the best chance of survival. And what we can do as scientists is that we can identify these chemicals and we can make them in the laboratory and manufacture them into medicines. And it's those medicines that we can take to then treat infection. Now, there's lots of different types of antibiotics, and the slide here shows you a number of different types of families of antibiotics. So there are some that will affect the ribosome, and that will prevent the bacterial cell from making proteins. There are some that will bind to chromosome, and that will prevent the bacterial cell from replicating its DNA, which is important for cell division and growth. And there are other antibiotics that might interfere with the cell wall of the microorganism. And that will mean that the bacteria can't produce a cell wall, it becomes then leaky and it bursts. And you perhaps are familiar with the antibiotic penicillin. It's probably one of the most famous antibiotics and most widely used. And penicillin works in that way. It prevents cell wall synthesis. The important thing about antibiotics is that they target just the bacterial cell and not our own, so that it's only the bacterial cell that it damages and it doesn't make us ill. And the impact of using antibiotics is quite astounding. And if we look at the death rate on this chart, so that's on the y-axis, over a period of 100 years, so from 1900 to the year 2000, we can see how the use of good health and hygiene, improved living conditions, has decreased the death rate from bacterial infections. But when we started to introduce antibiotics around 1940, then we can see a dramatic decrease again in the number of deaths as a result of bacterial infections. You'll also see from the graph that vaccines have also been really important. And my colleague, Professor Cameron Alexander, will give a talk about vaccines next week. So we can see the massive impact that antibiotics have had on treating bacterial infections. And this is something that's really important for our continued health. So with all these antibiotics, how do we know which one to use? Well, when a patient will first present with an infection, they will present with certain types of symptoms, different levels of severity of those symptoms. And so through understanding how the patient is feeling and knowing from previous infections and previous patients, we will know most likely that it's a bacterial infection, and we'll know the likely bacterium that's causing that infection. And then with that knowledge, including guidelines, expert opinion, and taking into account other patient factors, then we can prescribe a first antibiotic known as the empirical antibiotic that can be used to treat that infection. And usually that antibiotic works. In some cases, we might have to send a sample to the microbiology laboratory, and then microbiologists will be able to identify for sure which bacterium is causing the infection. And that information is passed to the healthcare professionals, and then the diagnosis can be reviewed, and if necessary, another antibiotic can be selected and prescribed to that patient. Now, you may have heard about the emergence of antibiotic resistance, and indeed what we're seeing is the emergence of the superbug. And the superbug is a bacterium that is resistant to all the antibiotics that we have available to us. Now, antibiotic resistance is when, as I say, antibiotics are no longer effective against killing that microorganism. And that happens because the bacterium can change its DNA and it can then resist the action of that antibiotic. This is a global issue, and it's something that's becoming increasingly prevalent and is of great concern. Because if we fail to address this issue, then we could be in a position where we can, by 2050, we can see 10 million deaths as a result of bacteria through which we have no treatment. And that could cost over £66 trillion. And you can see how widespread across the world this could be. So this chart here, this world map, shows you the number of deaths that would be as a result of bacteria for which we have no effective antibiotic treatment. And this is the annual death rate by the year 2050. So you can see the scale at which this could rapidly become an issue in 30 years' time. And so we're going to just talk to this video here, which just shows you how antibiotics, the more we use antibiotics, the more bacteria can develop resistance. So here you can see in blue, we treat with antibiotics the bacteria, and that's effectively killed. And we can introduce more and more antibiotics that are effective. But over time, and as we use these antibiotics, we see bacteria that's seen here in red developing that resistance to every single antibiotic that we introduce. And in the end, they're resistant to all our antibiotics, and at that point, it's game over. Now, there's lots that we can do to help fight the spread of antibiotic resistance. We can increase our infection control measures, so we can wash our hands more frequently and decontaminate surfaces. And we can introduce what's called antimicrobial stewardship. And antimicrobial stewardship is a programme that's used in healthcare settings such as hospitals or GP surgeries. And it's where we use our antibiotics that we have responsibly and effectively. And we also introduce these health and hygiene practices. And of course, we can develop new antibiotics so that as bacteria become resistant to current and older antibiotics, we have new ones that we can use that will be effective. And we can see how effective in this graph, how effective an antimicrobial stewardship programme can be. So here you can see the rate of incidence of pelvic inflammatory disease on the y-axis as a result of MRSA infection over a 6-year period in a hospital. And you can see that we can reduce that rate of infection by MRSA by introducing these good health and hygiene practices and being careful about the use of the antibiotics that we have available to us. And so now I'm going to end with this really good summary from the Wellcome Trust about antibiotics and antibiotic resistance.
Antibiotics have been a vital part of modern medicine for over 70 years, but overuse and inappropriate use in humans and animals has led to dangerous bacteria developing deadly resistance. Drug-resistant infections, often called superbugs, which can't be treated with the medicines we have today, are one of the world's most urgent health problems. Worldwide, these drug-resistant infections kill over 700,000 people every year. And without action, this number will continue to rise rapidly. Previously treatable infections and routine surgeries, such as hip replacement and cesareans, will be potentially fatal. Research to tackle drug-resistant infections has been too long neglected. The last new class of antibiotics was developed in the 1980s. Of even greater concern, we have not seen a new class of antibiotics to treat the dangerous gram-negative bacteria since 1962. The Wellcome Trust is committed to supporting scientists to work together with industry, governments, and civil society to tackle this rapidly rising problem. New treatments are a priority. We need new antibiotics and innovative treatments. We need new diagnostics, and we need new vaccines to prevent the spread of deadly infections. Through the CARB-X Biopharmaceutical Accelerator, promising research in all of these areas is now being supported. Public-private partnerships like CARB-X are vital to reinvigorate research and discovery. Wellcome has announced up to $155 million over 5 years to the CARB-X partnership. Drug discovery must work hand in hand with actions to ensure that antibiotics are available to all patients who need them in all countries and are used appropriately. Enabling responsible use and equitable access are conditions of CARB-X funding. We need to ensure that antibiotics, existing and new, are treated as a valuable resource and are used only for protecting and improving health. Global recognition of this urgent health threat has grown. However, we need to see more investment, more action, and greater urgency. Wellcome is working with governments, industry, and global health leaders to ensure concerted and coordinated action. Our goal is a world where excellent prevention and diagnosis delays drug resistance developing, and where there is a pipeline of new treatments that are used appropriately and available to all patients who need them.
And so if you're considering a career as a pharmacist or other healthcare professional, or in an industry perhaps, then you too can play a role in the discovery of new antibiotics that can be used to treat this issue, treat infection and address the issue of antibiotic resistance.